When you are pregnant, some people may give you advice or tell stories about how one can predict the unborn baby's sex. While it is interesting to guess the sex of the baby through non-scientific methods, you cannot rely on them like you would on medical procedures used to know the sex of the fetus. In this video, we'll tell you about the common myths that people believe are the indicators of a baby girl. But before going next, subscribe our channel and press the bell icon for getting daily parenting tips and pregnancy videos. Number 1. Fetal heart rate is high. It is said that if the heart rate of the baby is high and above 140 to 160 beats per minute, it indicates that you are having a baby girl. Scientific studies state that there is no relation between the heart rate and the baby's sex. The normal fetal heartbeat ranges between 120 and 160 bpm and might usually go lower before birth. Also, there is no difference between the heart rates of male and female babies in the first trimester. Number 2. Carrying high. Another old age belief says that if you appear to carry your baby higher, it indicates that you are pregnant with a baby girl. How a woman carries her baby depends on the weight of the baby, the growing uterus, placental location, and the amniotic fluid. It has nothing to do with sex, and the myth has no scientific evidence. Number 3. Severe morning sickness. The common belief is that severe morning sickness is a clear sign that you are carrying a baby girl. Morning sickness is associated with hormonal changes and it is one of the common symptoms of pregnancy. Most women experience it until the first trimester, while some may have it until delivery. There is no scientific evidence suggesting that fetal sex and morning sickness are related. Number 5. Carrying in the middle. Another belief is that if your belly protrudes to the front and looks pointed, it is a sign that you are having a boy. And if your belly weight is accumulated in the middle, making it look round, then the belief is that you are going to have a girl. This is similar to the idea of carrying the baby higher or lower. However, this is also a myth and may not help in determining the sex of the baby. Postural changes occur as the baby grows inside and the tummy bulges outwards. The way you carry is related to your body type, weight gain, and other physical conditions. Number 6. Mood swings. Sudden mood swings such as extreme irritability, depression, and anger are believed to indicate that you are probably carrying a baby girl. Mood swings are common occurrences during pregnancy and usually last only a while, so you are likely to experience mood swings irrespective of carrying a baby girl or a boy. Number 7. Breast size. Another myth is that if the left breast appears slightly bigger than the right one, it means you are carrying a girl. Breast changes are one of the early signs of pregnancy and are a result of hormonal changes. They tend to swell as they prepare for breast milk supply. However, there is no evidence linking the changes in breast size and sex of the baby. Number 8. Sleeping on one side. It is believed that if you tend to sleep on your right side for most of your pregnancy, you are probably going to give birth to a baby girl. This, however, is not true, and no scientific studies link the baby's sex to the side on which the mother sleeps. It is natural for a pregnant woman to change sleeping positions often to find a comfortable position for accommodating the growing tummy. Some use pillows underneath the belly or between the knees for extra comfort and sleep in a position that most suits them. Number 9. Urine color. Conventional wisdom says that dull yellow colored urine indicates that you are carrying a girl. Urine color is not related to the sex of the baby, but it tells you about your health. Dull or clear urine. Dull or clear urine could be due to hydration, whereas dark urine is the sign of dehydration. Foods, supplements, and medications may also change the color of the urine. Number 10. Craving sweets. A common belief is that when you crave for sweet food like chocolates and ice cream, you are having a baby girl. There is no connection between craving and the baby's sex. Cravings could be due to hormonal changes, nutritional deficiencies, pharmacologically active substances, cultural and psychosocial factors. However, there is not enough research to support these hypotheses. Disclaimer: sex prediction methods are only for fun and do not replace medical examinations. Our team believe in gender equality. We do not support or encourage sex determination nor entertain any queries on finding the sex of the baby. Thanks for watching our video. If you like this video and want more parenting videos, then don't forget to subscribe our channel.